It's fulfilling to see how music therapy, a holistic therapeutic approach, empathy, and to use a wonderful tool like music to help and support people.
But the biggest satisfaction is when we succeed in solving difficult, challenging cases. For instance, a successful cochlear implant surgery in malformed ear, or when years after cochlear implantation of a child with border indication, we obtain an amazing result.
Fantastic about my daily work is the ability now to follow a patient from the early diagnosis to the full rehabilitation. So I travel with them along the whole pathway.
My job is not only a surgeon, but also to help in ear screening and diagnosis of congenital hearing loss in children, especially from relative parents.
Last year, we started a very fruitful cooperation with MEDEL, which will help to rehabilitate children with hearing loss, to integrate as equals in social life.
My job is also my life journey in helping people to communicate better. In regard to cochlear implant users, it's wonderful to see how the CI surgery can bring the people of different age to the opportunity to hear again.
There are so many emotional events in my job, I can't name one in particular, but first fittings are often very emotional, and sometimes there are some tears from patients and their relatives.
There are a lot of touching moments in the music therapy. For example, you have like a 1-year-old hearing music for the first time, or singing old folk songs with a charming 90-year-old lady. It's very touching.
Especially on Christmas time, when I receive via social media short films with carols sung by cochlear implanted children. Nothing can be more rewarding.
I really enjoy it when I see all the patients who are implanted with a hearing implant a few months later, and when I observe that they are conversate to each other like a normal hearing person.
Skiing is my passion, but cochlear implant surgery is my profession. Giving the deaf people possibility to hear is the most noble thing in my life.
What I will remember always is the first moment an patient of mine, an old patient of mine, a pediatric patient, could hear through a cochlear implant. I always remember that face. It was fantastic.
There are, of course, more emotional experiences in my work of cochlear implant users. I could see preschool children at the age of 5 with very pure vocabulary and barriers in communication with their peers. In regard to the adults, the deafness brought many of my patients to the isolation. So it's nice and it's so big pleasure to see how the melancholy changes into the smile into my small and big CI users.
When a child listens for the very first time, it is an indescribable emotion. I constantly try to be as close and helpful for them and their families. In Albania, we still have a lot of work to do. Our goal is to give opportunities to everyone. Thank you.